All right, good. Mic is working now. Welcome, everybody. It's good to see so many familiar faces in the audience and some new ones. Welcome back to our latest Leaders in Public Health series. As you all know, the point of this series that launched with my deanship is really to make sure that our students, our faculty, our staff, and our alumni community have the chance to interact with some of the globe's most influential leaders in public health today, trying to bring in the spirit of inclusion, innovation and entrepreneurship, commitment to great communication, and most of all, folks that are entrepreneurial and thinking about how we apply data to creating change in the real world is the point of this series. So today, I am enormously honored and thrilled to welcome Andy Slavitt, who I've had the privilege of knowing for a few years and appearing on his podcast a couple of times. Those who don't know Andy, which I think is few of you, you should go and read up on his bio. But briefly, I think he's one of the world's most influential public health leaders in both the public sector and the private sector. Over the course of his career, he's influenced our nation's health in numerous ways, including leading the reboot of healthcare.gov. Right early in the ACA, when healthcare.gov was launched, we had a lot of issues, maybe similar to the FAFSA crisis today. And Andy led the team that got that up and going and really led to many of the successes of the ACA. He serves as a member of the President's Council of Advisors on Science and Technology, Working Group on Public Health, was Biden's White House senior advisor for the COVID-19 response, where he had a huge role in keeping the public informed, helping lead many of the vaccine initiatives. And more recently, outside of government, has served as founder and board chair emeritus of United States of Care, which is a super cool national nonprofit health advocacy organization, which does a lot of neat community engaged work. Founding partner of Town Hall Ventures, which we'll talk about a little today, a healthcare venture capital firm that invests in underrepresented communities and really has health equity at its core, and has also co-chaired national initiatives on the future of healthcare in the Bipartisan Policy Center. You may also have listened to his In the Bubble podcast over the course of the pandemic, which started out as being all about COVID and then expanded to other public health and healthcare topics, and is the author of Preventable, a best-selling account of the US's coronavirus response. I won't hold it against him that he's a graduate of Penn and of Harvard Business School, but we're truly honored to welcome him to Yale, where, like me, he will learn that he should have gone here all along. So Andy, welcome and thanks for joining us today. Please.
Go over here?
Yeah, sure. I put it on the wrong side to sit. Yeah.
Yeah, I've got a good side. I don't remember which it is though.
Yeah.
This was my first choice school to go to as undergrad. I didn't get in.
Silly Yale.
So
They missed out.
I admire all of you very much.
Well, we're really glad to have you here. So I want to start, because so many of the folks in the audience are students, by just giving you a chance. I gave the highlights of your career, but to talk a little bit about kind of your course of your career. I know you've referred to yourself as a outsider's insider, which I think is a great way to phrase what kind of as I look at your work. And so would love to have you share a little bit about how you got here and your career path.
Yeah, I mean, look, your life's going to be filled with crazy and interesting moments. And in retrospect, they will end up being, course paths you choose to take will kind of influence where you go and what you do and what doors are open. And some of them will be, in my case, not the obvious thing to do. In some cases, really the dumb thing to do. And I did the dumb thing anyway. And it works out. But so much of building a career, building a life for that matter, is figuring out what's important to you, making choices, getting opportunities to have an impact, having people take a risk in you. My story is filled with a lot of those things. I started out in a really traditional, boring fashion, came out of school in the 80s, worked at Goldman Sachs, worked at McKinsey, and went to Harvard Business School, just breaking new ground every turn. The boldness there was, but I did meet my wife at McKinsey, and so
worthwhile.
Got that going for me. And then one day, it was a few years out, and I got a call from my roommate from college, who was had been pre-med, and was a young physician, 31 years old. He had numbness in his arm, and he was really worried and kind of panicking. He had twin 1-year-old kids, no insurance. It turned out he had a brain tumor that was inoperable. Oof. And 4.5 months later, he died. And I was living in California with my wife and Jeff's widow, Lynn, and their 2 kids, Josh and Judy, came to California, moved in with us because they had no money, they had nothing. And that became a new journey for me, where I ended up leaving what I was doing, starting a company and this is the late 90s, that was focused on how do you help people who are un and underinsured get access to the medical care services that they need. And I will say, just as a quick postscript, Josh and Judy, Jeff, a bunch of our friends, we raised money to put them through college. They're now 27 years old. She's in medical school. He's an engineer, and so like I have a photograph of myself with Judy at the White House in 2015, which means a lot to me. But so I ended up on this path on healthcare, and it really driven by, as a lot of people are, a passion for an issue. I ended up starting this company. I sold it to United Health Group, which in certain audiences, my joke is every little boy's dream come true. Starting to United Health Group. I don't know if that works in this audience, but was in there for 10 years and started a business called Optum, and started buying primary care practices, and did a whole bunch of stuff. And I was a kind of corporate guy for 10 years. Some of that I liked, some of that I learned a lot, and some of it I didn't. But you can get a lot out of whatever experience you're in. And then in 2013, as the dean here, you prefer to use the dean.
You can call me Megan.
I like calling you the dean.
All right, I'll take it.
The thing crashed, and then this is when I made a stupid decision. I called Washington and said, "Hey, do you need help fixing it?" Okay, so here's a bit of advice, right? You make a call like that, what do you expect? You expect they're not going to even return your call, unless you're the only one that calls. And 3 days after I made the phone call, they had a press conference at the White House. Everyone was hot and bothered about the fact that none of this worked and nobody could get insurance, and this is the president's biggest platform. And they said, and Andy Slavitt's going to lead the turnaround. And then at the end of that, they said, and it will be fixed within 5 weeks.
Dude,
I hadn't seen anything. I didn't know anything. They hadn't told me that. But there's a lot of stories in there. I basically lived out of a hotel room in Washington and ran the government workforce and a bunch of contractors, and was brought to tears almost every day privately, but kept a brave face publicly, did press conference every day. And at the end of the day, we got 8 million people covered, and now there's 20 million people covered, and it's looking more and more like a success. So that's how I got into government, because the president then asked if I would want to stay and run the Centers for Medicare and Medicaid Services, CMS, which, again, you're faced with these choices. I was very comfortable. I was very happy with what I was doing. This was a different thing, and I did it, and it sort of changed my life. It was the best couple of years of my life, and then a bunch of other things that Megan described happened from there. So that's a little bit about my journey, and I bet yours will have a lot in common with it.
I would be thrilled if some of our grads go and have careers that have bits in common. I know, looking at the room and seeing some of our faculty, some of you already have done things that are also influential. And I think, one of the things that many folks in the room think about, as you and I kind of left from breakfast this morning, I was going to a student session. It's kind of this question of how do you maximize your chance to have impact in the world? And I think you're stepping up at healthcare.gov, that willingness to make the phone call and take on something that seemed impossible is one example. I think the stepping up in the face of COVID is another. I'd love to hear about kind of what drives you to kind of say, here's this impossible task, and I think I'm going to step in and try to take it on.
Right. Acting before you think, really. There was another occasion. By the way, I'm still scarred from the sunflower oil
Oh,
Right.
we went to Claire's, and we're both huge fans of peanut butter, and they don't have peanut butter at Claire's.
Nothing with nuts.
Nothing. So he kept trying to order a peanut butter smoothie, and they're like, "You mean sun butter?" And, oh God.
Next time you're in there, you can't say the word nut. So I think we should go have one of those things where you bring a lot of people into a place and like flash mob
Oh.
and like all kind of talk about peanut butter.
As long as they promise not to bring mayo to the two of us, we'll be, yeah.
Exactly. So I had my smoothie had
sun butter
in it right this morning, and I'm still in a good mood because I'm seeing you. But yeah, like I'll give you another story. I was so I got through with the ACA and left at the end of the term, and there was a new president, and I was out, and then a bunch of people said they wanted to repeal the ACA. The guy who was president, blanking on his name, the guy who was speaker.
Hello, Zoom people.
Ryan. All they're like, we're gonna repeal the ACA, and I was insulted. It's like, I mean, don't they know how much work I did to like save this thing? Like, why? Like, I was personally offended. I'm like, don't do that. So, I got together with a bunch of former Obama people in what actually the Wall Street Journal wrote a story about it, called us the shadow government, the shadow Department of Health, because we were like, these guys want to tear it all down. They're going to fail. They don't know what they're doing. We're going to fight to keep it going. And so, like, I literally made that my full-time job my first year out. And then they had a vote to repeal the ACA in Congress. And the thing that bugged me was that of all the people that voted to repeal the ACA, only 8 of them were doing town halls in their own communities with their district. And I was like, hey, vote how you want to vote, but go make the democracy work, go face the music, go hear the noise. So this is when I did my next foolish thing. I basically put out a tweet or an X or whatever you call it. And back then we called them tweets. And I said, hey, go have town halls if you voted to repeal the ACA. And if you don't, I'll gladly come to your community and have a town hall for you. And I'll be happy to go talk to people in your district about their health care. And 4 months later, 16 town halls, 40,000 people, many of them like in a library in Ohio or Arizona or Alaska, jam-packed with people, all of them there telling their personal stories about healthcare and what healthcare meant to them and what losing access to healthcare would mean for them. Woman in tears talking about how she was medicated for depression, and she's only able to work because of her medication, and she loses her job. She can't get insurance. She can't work. She'll never be able to work again. She'll fall into this cycle, and to everything else. And these were red and purple districts. These were people who just didn't want to lose access to the pre-existing conditions in healthcare. And I learned a lot. I mean, it was retail, like conversations, people, and these kinds of stories. And we used that, and it was in Arizona for a reason. We used that to pressure John McCain to vote no, which made me remember that. But I also learned a ton that way. And the Town Hall Ventures gets its name from those town halls.
So I'd actually love to talk a little bit about Town Hall Ventures. I think one of the things that Andy and I have kind of shared discussions about is this question of how do you actually create change in the world, right? We're here in academia, we're doing research, we can identify the problems, maybe we're creating some small programs, but how do you actually go out there and create change? And in particular, change around reducing disparities for historically marginalized communities. And I think Town Hall Ventures, correct me if I'm wrong, but you are the only venture fund that is, or one of the few that's focused primarily on health and minimizing health disparities. And you have been tremendously successful despite the fact that, we all know the stats around minority founders are less likely to get venture investment, are less likely to see success. So I'd love to hear about kind of your journey into creating that and what you think your secret sauce is.
Yeah, part of it is half of our founders are people of color, women, and probably could do a lot better than that. But I think that's a very, the private capital is a good old white boy's business. It's khaki pants and polo shirts and golf. I mean, that's kind of historically what it is. That's where the money is. They get people to want to look like them. So it's been a struggle for us to try to break that mold. This is the outsiders insiders thing. Is like I have this sort of crazy access to, and what to do with it? Give it to more people. But like the one of the principles of work here is like, people will ask me frequently, like, what country's healthcare system should we be like? That's a very common question I'll get. I'm like, I don't know, maybe we should be like Sweden, all like white and rich and cold. I mean, who knows? Like, that'd be wonderful, but that's not us. Maybe we be like Japan. Maybe we be like, and the reality is, there are certain things about us that are endemic to our culture. Some are for good, some are for bad. We have a kind of this image of ourselves as sort of Wild West, independent, bootstrappy people. That's not all bad. It's not great in public health crisis, but there's some elements that are pretty that about that are admirable. So my question when I was starting both Town Hall Ventures and United States of Care, which you referred to, was if we are going to make transformational change, and if I decide, which I decided when I was 50, it's like, what am I going to spend the next 10 years doing? When I reframe that as, what do I want to be different in 10 years? It clicked for me. And it was, to me, equity and access. Equity and access. But the way I felt to do it was, I thought, what are the two greatest tools things we're actually good at in this country? And one is the power of government. We're pretty good when we regulate well. We're bad when we don't. And second is innovation. We're like, we know how to innovate. Like, Sweden may have their snow, but we can innovate. So that's, and I think they've got a better slogan than they have their snow. But that was kind of caused me to set up these two organizations. One, US Care, which Professor Cooper has been involved in, and others here have been involved in. I like calling me that.
Nobody else does.
And working to basically change policies. And the other, focus on innovation. That this is Town Hall Ventures, where we're basically saying, yeah, the premise is pretty simple. We know how to deliver great care in this country. I know because I can get it. And my son, when he needs it, can get it. And my other son can get it when he needs it. And why? Because I work a salaried job and I don't have to show up to work to get paid. And I'm comfortable, and I'm white, and I can manage. And even if the system's messy, I know how to call enough times to get an appointment, and I can follow up. And there's a whole bunch of things that you have to do to work the system, but I know how to do it. And so, top 1% of this country lives to be 89 years old. Half the country lives to be in their mid-70s. So when people say, why are our health outcomes so much worse? I'm like, they're not. They're just worse for half the people. For the other half, they're just expensive, but they're pretty good. So we know what to do. And at CMS, I saw, as I traveled around the country, there is a solution. There is somebody solving almost every problem out there. You name the social challenge. Kids with dyslexia in the foster care system. I promise you, somewhere there is somebody who knows how to care for kids with dyslexia in the foster care system. The problem is they're doing it with a $100,000 grant on 7 kids, and the grant's about to expire, and they haven't scaled their knowledge, and they're not using technology, and there's no capital, and there's none of the things that we take advantage of when we innovate in the private sector. So I said, what if we could go find those things and put the traditional tools behind them? What if we could give them, open every door to every policymaker and CEO in the country? What if we could help them build technology? What if we could help them recruit management teams? What if we could help them, really build businesses to solve these problems? And the bet was, I think the unknown at the time was, would these become really good businesses? Because in my opinion, they had to be. Because doing something that like felt good, but only kind of good-hearted people would invest in it, is not sustainable. Can I say assholes?
Yeah.
I wanted assholes to want to invest in underserved communities because there was a lot of money in it. That was like, if we're able to rely on the goodness of our hearts and our pets, it's not going to work. But solving a big problem for lots of people is how you create a great business, a great iconic business. And so we set out to do this. And today we have 35 companies that we've either started ourselves or invested in. They each are focused on either an underserved community or a medical condition that disproportionately affects low-income people, like kidney disease. And we found amazing entrepreneurs out there. Of our first 15 companies, 7 of them are now billion-dollar companies. So we're going for big ideas. We're trying to scale things nationally, and it's in everything from crisis mental health to kids and Medicaid with disabilities to health for the LGBTQ+ community to rural health to health for care for dual eligibles to cognitive impairment issues to we just invested in a company that provides school counselors for mental health for kids in schools. There's really great ideas out there. Not all of them, by the way, are appropriate for private capital. Some of them are best done in a government form or in a nonprofit form or in some other form. But increasingly, we focus on models that pay for outcomes. You basically can say for every time you can keep people healthier, keep them out of the hospital, and you save money, that's how you can build a profitable business. And that's kind of been the theme.
And the challenge, of course, and kind of right. So those of you that are in health policy or are taking our amazing health policy courses know that the challenge, right, is with the churn in our insurance market, getting insurers to invest in keeping people healthy can be challenging. So you found success working kind of with delivery networks and folks like Kaiser. And
there's a few things that work. It's very hard to make it work in a fee-for-service environment. It's not impossible. We have a few companies that work in fee-for-service. All of our companies have to care for everybody that comes in the door, whether Medicaid, uninsured. So they have to find models that work. And I really don't even like models that are subsidized by commercial, because then I think left to their own devices, you're just going to see less and less of the patients. So I want management teams that are embracing that, and I want models that embrace that. We just launched a company yesterday that's focused on providing integrated care to frail elderly seniors. We co-launched it with Kaiser Permanente, called Habitat Health. And it's an alternative to nursing homes that keeps people in their homes. We tend to work on these ideas for a year to a year and a half before we launch something or invest in something. We often think we get to the end and think our thesis is right, and then it turns out we were wrong. By the way, not all these things have worked. I'd say 75% of them so far seem to be working. And
that's a pretty good rate.
And of those, half of them I think will be really big, national, transformative business. I mean, we're trying to create things that really will create national change and national models. Very simple things like 90% of Medicaid patients who are discharged from a hospital with a referral to see a mental health referral don't ever end up getting that met. And of course, we live in an open loop system in healthcare, so no one really ever tracks anything. Hey, here's your referral. No one happens. Turns out 90% don't. We have a company, it sounds super specific, right? All they do is work with discharge planners and case managers to get people who are discharged from hospitals their mental health visits who are on Medicaid. That's literally all they do. That's their passion. And they do it really, really, really well. And no one else wants to do it because it's like in the bowels of the healthcare system somewhere. But it's incredibly cool. We met this young woman who had personal experience and a passion for this. And she's like, trying to get in my way of getting this done. Right. And it's good. And what's nice is it's not like, hey, it's an app and 15 people are also releasing this app and makes your Peloton go 1% faster, and therefore I'm going to be 1% more self-actualized. And no, it's like nobody's doing this stuff.
That's awesome. I'm going to pivot a little bit. You may have kind of caught a little bit of Andy's irreverence over the course of the last 20 minutes, which I think is one of your great strengths. I think it makes you authentic, and I think it informs your communication skills. And one of the things that we're thinking about a lot as a school is how do we communicate better? How do we help grow trust in communities? How do we share our knowledge in ways that are both comprehensible and actionable on the part of the communities that we care about, come from, work with? And I think it's one of the places where you truly shine and are distinctive. And so could you share a little bit with us about your journey as a communicator? If you want to talk about In the
Sure.
Bubble, that's great. If there's something else, and obviously In the Bubble is super fun. And if you haven't listened to it, you totally should,
I will say-
particularly my
I will
epithet.
say
No,
there's a
just
pot,
kidding.
there's a pot and kettle thing going on here, because you are probably the best, and certainly in the league of smaller people who communicates with compassion, understanding, calm, truth,
Thank you.
but amazing stuff. Amazing. If you didn't know this about your dean, it's totally amazing. She'd be the last person to tell you. But like, so it's interesting. Like I was like minding my own business, and the Biden wins, and I've been
I
asked,
doubt you were actually minding your own
Okay.
business, but okay, keep going.
I'm I'm a troublemaker. Fine.
Yeah.
Fine. So, but I was not planning on going back to serve the Biden administration, is really what I was going to say. And they had asked a couple times, and I said, no, let's move down to California. We became empty nesters. This is an exciting part of our life. We bought a house. We're not gonna do that. And I just done our third fund, and then I got another call saying, hey, the election over, would you consider coming in? And I said, no, but I like all these people that used to work for me in government, they're great, and I gave them a bunch of names, and I'll help them, and I'll mentor them, and all that. Okay. Then it's Christmas, and they call again, and they're like, you need to come. You need to come to the White House. And I was like, you're scaring me. And they're like, yeah, we're scared. We're scared. I'm like, well, what's going on? They're like, there's literally no vaccines. They're approved, but and 3,000 people a day are dying, and we got to get this done fast, or the country can't open again. And now, why did they call me? Because I had worked with them before, so I was a known quantity. It was not like I have some secret gift, and I also knew how government worked and how the real world,
Mhm.
the real world worked. And so it was like, and when you work with people before, you're like, oh, they can start a sentence and they know what they're talking about. So they're like, go do that. So I was like, I really didn't want to do this, but I went and got an apartment half a block from the West Wing, the Oval Office, and basically just said, I'm going to do this for 4 months and get the vaccines out. We'll deliver, et cetera. And I'm like, but I didn't even ask what they wanted me to do. It was just like, we got to solve this whole problem. So the first thing, they're like, we want you to lead the communication with the public, to hold the press conferences, to talk to the public about things. Like, okay. If you remember, like the last press conference that the prior administration had was like in September, like it was like 4 months before, and it was like a mess. And it was the president like fielding all kinds of questions and saying some things that were people didn't find trustworthy. Then they just stopped communicating, and then they stopped a lot of the scientists from communicating. So I was like, okay, this is a good opportunity. And I remember I was sitting in, I was called into the West Wing and into the Oval Office, and President Biden was eating lunch, and he had a couple questions, and I was just talking through them. And at one point I said, this is not going to be great political news, but this is kind of one of the realities. And he's like, it might not look the administration look great. He goes, here's the thing, Andy. Don't pay attention and don't worry about how you make me look. Give people the information they need to make better decisions. That's all you've got to do. Very clarifying, right? And by the way, an advantage over the people who were in the prior administration who had to worry about how they made their boss look. He's like, I don't care. He's like, just give people the information they need. So I was like, okay. And so I had this image in my mind. I'm going to go out and getting briefed by the comms team to go sit in front of the press, and like, oh, by the way, you're going to be live on ABC, NBC, CBS, and CNN, MSNBC, like, and then all these national, like the first press conference is going to be live. And I was like, oh, is that good? Is that unusual? Like, that's good, but it's unusual. Like, that doesn't happen very often. I was like, oh. For some reason, it didn't like register. So it didn't make me nervous. It didn't make me nervous. I was like, that was like fine. So like, but I had this image in my mind of like, who am I talking to? And I had this image in my mind of talking to my sister. Okay. Why my sister? Because my sister, a few years younger than me, very smart, I respect her to death. She's not an expert in healthcare, doesn't know this topic at all. And if she called and asked me a question, I'd want to give her a truthful answer, a complete answer, but I would trust her to handle the nuance of the answer. And I'd say, generally this, here's our certainty, kind of here. I'd give her the best advice I possibly could in the straightest language I possibly could. So I had that in my mind. As I was about to walk out, I called Lana, who's back in California, and I'm like, hey, I'm about to go out on TV with all these, and she's like, oh, that's nice. I'm like, you could watch too. And she's like, yeah, I'm out running errands. I was like, I get it. I'm like, okay, I get it. But by the way, I'm gonna go talk look for the first time, and she goes, competence is sexy. and I was like, competent, we are so craving competence. Just be competent. And I was like, oh, it's getting me kind of excited. I was like, I never knew that you covered. So it's like, well, what she was really saying, by the way, was no jokes. Like, stop with your dad jokes. Like, no jokes. Just, we don't need that. We need competence. And that was like literally backstage before I walked out. And then I walked out, and I started talking, and I had points, and I had Fauci and Walensky on camera, and like that, and I was like, I'm going to tell the straight story, talk about the plans, etc. This guy's going to talk about the science, and this woman's going to talk about public health, and then I'll come back, close it, and I'll handle questions. That was kind of the setup I said. So you hear directly from scientists, you hear directly from them, and I'm not representing. There will be no political message about public health. It'll be the scientists. And then we do our thing, and then the questions start. Yeah. And they jump all over me, just like you guys are going to do in a minute. And they were like, the press is always like, they have this always accusatory tone of voice, so you can instantly like, jump back and be defensive. When are you going to get vaccines to people who need them? There's all these people on websites and they can't get all their vaccines. Well, we have a shortage. I'm like, I don't know if anybody said that. We have a shortage of vaccines. And in this country, we're used to getting what we want when we want it. And I know it's very hard for people to be in a situation where they not only they want something, they feel it's very important to them, and they can't protect their family without it. But here's what I'm here to tell you: we have a shortage. There's a bunch of us who aren't going to sleep until we get rid of that shortage. The shortage will last weeks, maybe into months. In that time, it'll be very uncomfortable, and we're going to make tough decisions about how we prioritize who gets the vaccines first. And we're going to get many more made. In fact, we just purchased another 100 million doses, and people in factories at Pfizer like unclogging systems, and we had to ramp them up, but I wasn't going to. And I'm like, I'll tell you every week how much we're producing, and then we'll know when the gap closes. So I thought that was like a pretty simple answer, and I got like the fact that I said we have a shortage. I had tons of people, nurses, all saying, "Thank you for telling us the truth." And I got so much of this like. And it's funny because it wasn't scripted, and you can imagine like Slavitt says shortage, like that could be, but I was just like, what's the most useful, descriptive, straightforward way to communicate with someone that you care about and want what's best for them and want them to be able to plan, and you're not focused on the politics of it. And that came through, and I tried to do that with every answer that I could. And so to extract from it, I'd say, and I'm guessing you feel similarly, is you ground yourself in a few principles. And in that case, those were my principles. And then you just stick to those principles. And if you don't get thrown off your game, you just remember, I'm not talking to some massive people, I'm talking to my sister. You just remember that I don't have to worry about anything other than being helpful to you, the audience. That's very clarifying, as opposed to being up there with a million other agendas.
Yeah. I think that's exactly right, to keep that North Star agenda as your prime driver of how you communicate. I had
Competence.
Well, I'll say I had someone say to me early on to not let my intellect get in the way of my empathy, which I thought was smart also, because I think for those of us in academia, we're used to like having to prove we're smart, or like having to say a new thing every time and somehow be different. And really folks just wanted, like you said, to hear the truth. If I channel John McCain, kind of that straight talk,
Yeah,
you know?
yeah. You know, I
Which
mean,
is-
if you're blessed with intellect, that's a challenge.
It's been a sore spot for me
Been
my
sore
whole life.
spot,
So,
yeah.
all right. So final question to you, and then I will open it up. I think, as you know, we are transitioning into independence. Our goal is to be the most transformative school of public health, certainly in the country, and hopefully to help transform health across the globe. What advice would you have for me or for us as a school as we kind of approach this transition, this spinoff moment? Yeah.
I mean, there's a couple things that I think are kind of good universal things. Get out of your bubble.
Mm.
Talk to people, listen to people. You know, it's a lost art, but like before the internet, like we actually like had to go places and call people and like see things with our own eyes and stuff like that, which I know like you're like, okay, old guy, like doing some of that stuff. But at some level, like you can only be a product of what you hear and see and observe every day. And so if you're just talking to each other and just seeing each other, you know, you will have a lot of you'll quickly get more and more confident in the thing you already believed and that others around you believe, but will you be gaining insights?
Mm.
And so however you do it, whatever your approach is, like, and look, a lot of it's just getting over the personal fear and this taste. Like I hate cocktail parties. I hate new people. What are they doing in my life? Like you don't belong here. I just talk to people already? Like, no. So it's a journey. Some people love that stuff and they're great at it. Like for some of us, it's work. We're coming. But, and then you get into but I got to show them what I know and I got to impress them. And then you're like, but wait a minute, all that time I was pressing them, they were talking and I didn't hear a freaking word they said.
Mm-hmm.
So like, oh my God, there's actually stuff to learn. There's actually stuff to learn and at my age, there's a ton to learn. And so that's exciting. So I think some of this is this cultural spirit thing, which is, you know, you don't want to be ivory tower, don't be ivory tower. Like that. And guess what? You're in a community here, you're part of community here that is far further and broader than just what happens at Yale. And I think like don't underestimate how much people will want to talk to you. You know, you come from a very prestigious place that I didn't get in, and you have something to say. You have questions to ask. I'm gonna keep distracting over here, so you don't look over there. That's one. Secondly, like think about the tools. If you go to kind of end state, go, I'm working on this thing. You know, is my problem bite size enough? And what are the tools to getting it solved? And it's kind of the fun part because you can be totally creative. I mean, there's the private sector, there's the public sector, there's policy, there's government, and by the way, in combination, generally speaking, which is the hard part, but can you really pull off like that level of alignment? Pick the things you're passionate about. You know, those are up to you. Pick things you can make a difference in, and you know, measure it and fix it. And like, I think there's just a certain things that you guys will do that other people won't because they're going to be in a more restrictive environment where you can't pursue the right answer. You've got to pursue either the profitable answer or the answer that someone's boss told them to pursue. Well, you guys have very different levels of freedom. Plus, what I understand from talking to the dean and others is you guys are absolutely incredible. So, like, that's amazing. Like to be incredible at something and as passionate enough to lead you to be here. That's super exciting. So, you know, there's a lot of blah 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 coming out of me right now, but
I love it.
but I really think like over time I believe that the hardest thing to overcome is yourself sometimes, because you have the aptitude and the passion and the knowledge, and you can get the things you don't know, you can only discover by getting out of your own skin and getting at it and talking to people, and so that's the fun part.
Awesome. Thank you. And sorry, I got a frog in my throat somehow. I'm not actually crying. I'm like, yeah, he made me really emotional.
Actually crying.
Hi, wow. Tears of joy. We will open it up for questions. We have Eve, we have Effie, thank you. I think Leah, someone there, someone here. And we'll do a Zoom question too. We'll try to get through them. I know we have to be out of here for the next class, so.
Hi, thank you so much for being here. I really love what you said about doing what's right versus profitable. So I'm wondering, with over 24,000 people dying of COVID this year, and roughly 30% of people who have ever been infected with COVID developing long COVID, and about a third of those people still not having recovered, what do you think will it take? How many more people have to be injured before the administration informs people about the ongoing risk posed by COVID and subsidizes N95 masks, HEPA filters, tests, and PTO for people who will be disabled or die from infection? Thank you.
Yeah, great question. My son got COVID 2.5 years ago, still dealing with symptoms. My younger son. What I think you're speaking to, and I'm not going to put it all on the government, I'm going to put it on our country as a whole, is like there's a very interesting sociological thing happened here. It happened with the flu in 1919 as well, where people's attention and tolerance to dealing with a hard thing has limits. And that limit is probably proportional to how safe they personally feel. And I will tell you that as soon as people felt like, oh, this is happening to other people, old people, people of color, people who work by the hour, people with compromised immune systems, but that's not me. Why are they making me sit indoors?
Mm-hmm.
Why are they not letting me go to school? Why are they so? And by the way, I'm not criticizing those people. Also happened when people got vaccinated. There are people who were arguing that we should do absolutely nothing that's not safe until they personally got vaccinated. And then a lot of them were like, this is ridiculous that people can't go to school and all that. So people's postures, it's a really funny thing to observe. And I think the big picture of your question is like the body politic, the public, 2.5 years in moves on. And the people that still are focused on this and care about it are passionate, feel like increasingly marginalized and left behind, and it becomes less important. Now, the facts are about 100,000 people will die of COVID this year, estimate. That would make it what, the sixth?
More or less 6 or 7.
6 or 7.
Yeah.
And
Depends on how those other numbers.
right.
Yeah.
And
whether we're coding it, of course, because
everyone ahead of every one of those conditions, including, they're all preventable. They're all preventable in some form.
Mm-hmm.
Some are preventable by blood pressure, more blood pressure cuff. Some are preventable with toxic waste. Some, and all of them need champions and people to be passionate about them. 40,000 deaths from nursing homes, in nursing homes from the flu every year. Been the case forever, and nobody raises a finger about it. No. Congregate settings, there's a lot easily could be done. All the things you talked about around ventilation. Why are those things out of nursing homes? And the administration proposed a complete overhaul of nursing home safety, and the nursing home industry pushed back and said we'll go out of business, and had a giant fight and is resisting doing anything. So I guess I'd say my answer is, where your passion is, you can't quit. You have to understand what you're dealing with, and that the battle sometimes looks more uphill when large swaths move on. But just because the whole country isn't focused on it doesn't mean that you can't make progress and things can't get done. It just has to happen in different ways. And I think ventilation is a great example. Final thing I'll say, and I think you all know this, which is the reality, is public health is less well thought of than before the pandemic began. There is a large portion of the country that let's say we went too far, and kids suffered at school and all kinds of things. And I think it's important to be sympathetic to all kinds of suffering, including mental health suffering and all these other kinds of things. But like going to Congress, you think after a pandemic, you should be able to go to Congress and say, hey, we have some money to prevent this from happening again. And Congress is like, that's the last thing we're in the mood for. And in fact, the $27 billion you put towards pandemic preparedness, they carve back. So it is an uphill battle. It is a battle worth fighting. We have to make progress. We have to have the attitude that every life matters. But it's but I think it won't be the most important thing to everybody. So the people to whom it is the most important thing have to fight that much harder.
I love that. And I know we've had discussions about other kind of topics over the course of the last 9 months that I've been here. And to me, the biggest thing that you all can take out of your training for the students or for our faculty that we have as people who have been trained is the ability to use the methodological rigor, the skill set that you get through your training in public health to work on the issue that you care about in collaboration with your community, right? And if I'm just paraphrasing a little, that's, yeah.
You said it better.
I think 1, 2, and then we'll try to do a Zoom question if we have time.
Thank you so much for speaking with us today. I have a question related to, you kind of kicked off your discussion of the different businesses that you're looking at that are looking to address like areas of health equity. And I'm a health equity consultant out in the real world. I graduated
And a
last year.
YSPH grad.
Yeah, YSPH grad. And I feel like an issue that I constantly see in my work is we have all of these great resources, and I work mostly in private sector, but some public sector as well. For like LGBTQ health, like you said, rural health, like all of these populations that we know need that specified attention, but we're missing the contact point. So I'm wondering how, like in your businesses, how are you identifying people that need access to these resources? And like, how are you actually like managing care in that way and making sure, you mentioned with, Medicaid discharges and how they're like getting that referral and getting sort of that like high touch, we're going to make sure that you get onto this program, but where's the connection point there? Like, how are you making sure that you're reaching the people you need to reach?
Yeah, I mean, it helps to bring in a management team that comes from the communities that they're serving. So, Plume Health, which is one of our companies, is the largest provider of trans care, Plume. Largest provider of transgendered care in the country, largest number of trans physicians under one roof. It's a metaphorical roof, I guess, because they're all over the place. And there is no greater, I've never seen a larger movement in depression and anxiety scores than when someone is 90 days into that program, because they're finally, it's because the place they're starting from is so horrible and they're so misunderstood. To someone who is like, oh, now you're home. Like, I know all of your issues you're dealing with, because you're dealing with people who you don't have to walk into a waiting room where you feel like an outcast. And by the way, you don't walk into the waiting room because you don't want to feel that way. The company we just invested in called Rise, which focuses on school-based mental health. It's an entrepreneur who's also a former teacher. And part of what we do, part of our function as investors to add value, is to get them connected to the right people. So I've introduced them to the head of each school district of the major cities to create that connection point. This is sort of the like people who like, I've got a great idea, but nobody's opened these doors for me. Like part of our job is like, let's open these doors. Who's got the Medicaid contract in this state that pays for these services? Let us get you to those people like right away and tell your story. And you may or may not be ready. Like they may say, this is what we need to see in order to work with you, but you got to know that realistically, and then get to that spot. And so I think there's people who kind of believe that magically, because I'm trying to do this, you'll let me in to do it. I'm like, no, understand what it is that they're trying to solve for. And they may say like, yeah, I need a certain level of scale and customer service for what you're doing. And then you have to decide whether that's worth the investment. So help people speak the same language, get them together, hire people who know. Like, I tell everybody, don't guess. don't guess. Hire somebody who knows. Hire somebody. You want to go talk to that company? Go hire somebody who's worked at that company before. Like that way you won't guess.
You told me a great story this morning about the CHW, the community health worker at City Block, which, by the way, if you're at City Block Health, which was the first company he invested in, is going to be presenting their case study, which some of you helped create at the Innovation Summit in late May. So if you're still on campus, please come in here. But yeah, that story about the CHW who was able to get in the room.
Yeah, I met the City Block worker. They basically are like, we're going to work with people who are duly eligible in urban settings and not wait for them to get sick, but try to provide them with health and care and beforehand and go fully at risk. And I went and talked to a handful of community health workers about their morning one. Said, tell me about some of the visits you had. And the woman said, well, this woman who was like, I could tell she was not eating, and I could tell she hadn't been shopping, and I could tell she hadn't picked up her medication. And I was like, just curious, like, how did you get in the door? How'd you get her to trust you? And she was like, oh, I used to play on her floor when I was a kid. My grandmother lived on her floor. And I was like, it dawned on me that their model is don't get people to trust a system they don't trust. Find people they already trust and empower those people. Mm-hmm. And she had an iPad and she was very tech savvy, and she was like, I would solve the problems and I got it all taken care of. She just walks and she's like, I could tell when she's like, oh, that woman, like, she's not looking me in the eye. I've known her my whole life. And like bringing that personal touch to bear, I think is one way to do it.
That's awesome. I think we have time for one more quick question, probably.
Hi, thank you so much for coming. And this is building on the City Block point. So we've seen the success of capitation in models like City Block. But on the other hand, we had like last year, the CBO report that said that value-based care models have not been saving money. And there's been a lot of hospitals.
Reading CBO reports.
A lot of health systems that are resistant to wide-scale change to value-based care. Do you think that there is a world where we can have models like City Block be the norm rather than the exception?
Ooh.
So I don't know, but I'll say this. First of all, with that report is a little bit of a work in progress, because if you look at the latest models like Reach, they're actually getting great results. And in the latest models are built on the failures of prior models. And I tell people, like, who has an iPhone 13? I'm like, okay, can I trade it? Would you like an iPhone 1? No, you wouldn't, because it's a piece of junk today. But the only way you got to the 13 was you had a 1, and then you had a 2, you had a 3, you had a 4. The purpose of CMMI of these models is to rapidly innovate and fix. So, like, people come to these grand conclusions like, oh, it's a failure, it doesn't work. It's like, yeah, probably a bunch of it didn't work, and probably some of it did. Your job is to find out the part that did, fix the parts that didn't, and keep going and keep iterating. And we don't have patience for that in healthcare. So the CBO report was like a lot of CBO reports, I think did justice to what it was trying to solve and not to the bigger picture and the bigger question. But a lot of the models think that should work. If we send people home, like a lot of stuff that should work doesn't work. You got to find out why. And they got to be curious, and the people have got to be curious. So, I was telling the dean that the reason I invested in City Block Health is because literally I felt like someone has to figure this out. It has to work. I had no evidence, no proof that it would work, but believe if it doesn't, we're we're up a creek, and maybe these guys will figure it out, and so they figured out some things that work. And then guess what? There's now, last count, 83 companies spun off of City Block. 83 former City Block employees that have started or are part of starting their own company that is basically a copy of City Block. So once something works, like everyone rushes to it and everyone knew it all along and everything else. So you got to get these mini breakthroughs, I think, in my experience. And then everyone's like, oh yeah, it's obvious. Like, yeah, well, it wasn't obvious yesterday. But so I'd say don't give up hope that there won't be breakthroughs. There will be setbacks. And like, we got to deal with them as setbacks, not as failures.
Well, what a lovely note to end on, which is to take all of your setbacks as setbacks, not failures, and keep going. Andy, I cannot thank you enough for joining us today. Really just so appreciative. We can give him a warm Before folks leave, a reminder to look under your seat to see if you are the lucky winner of a Leaders in Public Health swag bag today. And I do have a little swag bag for you because
right.
Yale believes deeply in swag.
Swag.
And
I
so
love swag.
apparently they were giving out Yale branded vodka during the pandemic. And I missed that by not being here. I don't have that for you today, but
Awesome.
you know.
It looks like a hoodie, probably.
Yeah. Thank you guys. And for the students, please do, and faculty as well, please do join us at lunch.